Hello everyone, and welcome to Module 13. In this module, I'll talk very briefly about translating research into practice. This is a particularly relevant module for most of you who will be going on and doing education or therapy or some combination thereof. And it's one of the main reasons that there are research methods classes in very practice-oriented kinds of programs such as this one. So one of the main things that I hope that you got a sense of, particularly after reading the Solomon article, is that it's so important to be able to understand and synthesize basic research, to be able to think like a researcher, develop research questions, understand how to operationalize your variables, your constructs, and measure those. And so that's one of the things that I am particularly interested in driving home to you, that you should be able to think like researchers even though you will be practitioners. And being able to understand the research literature will help you understand the mediators and moderators of behavior and behavior change, and understand all the cognitive and affective factors relevant to behavior, behavior change, and the acceptance of interventions. So being able to know what components of interventions are effective, and being able to understand the research literature behind that piece, as well as to be able to understand the basic research literature about what factors predict engaging in, for example, sexual risk behavior or becoming pregnant when you didn't intend to, things like that. And it's one of the main reasons I think that practitioners should be trained in research. And I think the article really drives that home, that we should help develop the capacity of practitioners to engage in this kind of research, in program evaluation research, and translational research. And I also think, and the article gets at this, I think a little bit, but not quite so explicitly, I think that researchers should have experience in practice settings, whether it's conducting intervention research in very applied settings, or actually having some experience having worked in practice settings. I think as a researcher, it helps us to understand what the very real and practical barriers and factors are that practitioners are dealing with when trying to implement interventions or conduct research in applied settings. So as much as I think we should be helping practitioners gain research experience, I also think we should be helping researchers understand what the realities of this work looks like on the ground. And I hope that this research, that the Solomon article also helped you to see how important cultural understandings and potentially community-based participatory research are in intervention and education research, and program evaluation more broadly, and in translational research specifically. It's important to develop shared languages. Again, this is a reason why I think practitioners should get some research experience and researchers should get some practice experience, so they speak the same language. Often we may be talking about very similar things, but using very different language. It's also a main piece in getting stakeholder buy-in. So whether that's cooperation, ideally something more along the lines of collaboration rather than cooperation. I think we should be particularly attentive to training practitioners and helping researchers understand practical realities. And in much of this research, we're also looking for funding to help conduct research, whether that's translational research. But I think one of the things that we need to be particularly attentive to as researchers is helping secure funding for that research and making sure that that funding benefits community organizations or whatever locations that we're actually trying to apply and evaluate intervention or educations or therapies. And we talked about program evaluation research earlier in the semester, but I want to touch on it again briefly. As we talked about before, program evaluations determine implementation, effectiveness, and efficiency of a program, intervention, therapy, education, curriculum, etc. When we talk about transferability, we're talking about the extent to which an intervention evaluated in one specific setting might be as effective in another defined setting. And so I think I've mentioned this before when we talked about randomized controlled trials, but it's also important to think about the distinctions between efficacy and effectiveness. When we talk about efficacy or efficacy trials, we're talking about conducting research to evaluate the effects of an intervention, therapy, curriculum, whatever, in a laboratory kind of a setting, in a very research setting. So if we're conducting research in my research lab, we're bringing people into our research center to participate in an intervention. We're doing it with people that we have trained to conduct the intervention in our research center. We would be conducting an efficacy trial. We want to see if there are effects of this intervention in a research setting. We then may take that and try and implement that intervention in a real world setting, in a hospital, in a clinic, in a school, whatever context that we want to implement that intervention. And we want to see the effects of that intervention in a real world setting, in which case we're conducting an effectiveness trial. And so we often talk about the distinctions between efficacy and effectiveness, and those refer to the distinctions of finding effects of an intervention in a lab setting versus in a real-world setting. And there are several keys to evaluating interventions, education programs, therapies, and I think the article drives home some of these points that we have to have an understanding of and skill in utilizing research methods, which is hopefully what you'll have by the end of this course. We want to understand programs' underlying theories and the key components of those programs that are effective. We also want to assess fidelity to programs and learn more about how people make decisions about adapting specific programs. So often you'll see in various settings, particularly maybe educational settings, that teachers choose a sex ed program, for example, and say, great, I'm going to use the sex ed program, I've chosen it. Here's the pieces of it that I really like, and here's the pieces that I don't. So that's what I'm going to teach. And so that may be a particular way of making decisions about adaptations to specific programs or curricula. So it's important, if we want to evaluate the implementation of those programs or curricula, that we understand what kind of adaptations were made, and also, the extent to which that program was implemented with fidelity. So the extent to which that program was implemented as it was laid out in its original development. And I think the article does a really nice job of laying out how important it is to understand communities and populations, how they will respond to particular interventions, the factors that drive behaviors, and perhaps present barriers to health, to sexual health, in those particular contexts. Understanding the implementation context, the resource limitations, the training of staff members, the time that you'll have with your particular population. If you have questions, thoughts, post them under the general discussion forum or drop me an email and let me know. All right, thanks.